Welcome everyone. This is Dr. Shirin Towfigh here for another episode of HerniaTalk Live, our Q&A every Tuesday. Many of you know me. I'm a hernia and laparoscopic surgery specialist. You can follow me on Twitter and Instagram at HerniaDoc. On Facebook, many of you are joining us live at Dr. Towfigh. And at the end of this episode, we will make sure that you have full access to this and previous episodes. Today's guest panelist is someone that I know very well. Her name is Marcy Gerbina. She is a functional movement specialist. I got to know her because I'm a surgeon and I need help with my movements because surgery really messes up your body a lot. And Marcy, it has been great. You can follow her at Move with MJ on all different social media platforms, including Facebook, Instagram, and Twitter. So without further ado, hi, Marcy.
Hi.
Thanks for joining me.
Yeah, thanks for having me.
So full disclosure, Marcy has saved my life multiple times, lots of prevention.
Maybe not your life, but your
injuries.
body.
Definitely my body, my neck, my back, my shoulders. I come to her and I was like, oh, I did 3 cases yesterday, or it was a long day operating. And somehow she knows exactly what procedures I need to do at her kind of like gym session thing. And like, she just fixes me. I don't know how you do it, but I'm not the only surgeon that you treat. So
That's correct. Yes, I have experience with surgeons and the way that they move their bodies and the way their bodies need to move. It's just like any other individual, an athlete, a painter, a tech person. So
why are we always so injured?
surgeons, because you are
Yeah.
standing over an operating table all day and you are giving 99% of your energy to other literal bodies.
I know that's true. Plus, it's not just like, it's like laparoscopic surgery, it's open surgery, it's even robotic surgery sometimes can be a problem. So, I feel like no matter what we do, there's something that's going to injure us.
Yeah, and I mean that's true with any walk of life. That's not that unfortunately that is not exclusive to you surgeons. So
what other people do you see having so much occupationally related, nurses probably, a lot of occupationally related injuries?
I see occupational related, I don't want to say injuries, but I see, developments in that habitual movement pattern and constant states in all of my clients. And in my own body from, just working with other bodies. So like right now, my posture is not really where I want it to be, but I'm also like looking at a computer screen. So I'm going to give myself like this much.
Do you feel like once you hit 40, it's all downhill?
I haven't hit 40 yet.
But once one
but the closer I get, yeah, like I feel like the whole like, oh, when you hit 30, that was a lie. But the second 31 hit, it was like, wait.
Yes.
It wasn't.
I agree.
They just also gave you 30. They were a year early.
Yeah. Yeah, I don't know. I feel like the body, I used to be on call and doing like 18, 20-hour works, no problem. My feet would hurt maybe, but it wasn't like neck or back or soreness, or I could kind of bounce back the next day without a problem when I was younger. And man, now like, I mean, thank God I have much better control over my schedule, but surgery is a very demanding on the body.
Yeah, and I think that's true again, just with anything, like as we're younger and we have more energy, like think about it as a battery. Like when you're a new battery, like you have all this juice and you can go, and like you can kind of like recharge. But like as the battery gets older, like a car battery, right? So as the battery gets older in the car, like eventually you're gonna have to change that battery. But luckily, as living, breathing beings, we have ways to self-recharge and to take care of ourselves. And that's why it's so important to make these good patterns and these good habits for ourselves so that they can integrate into your everyday life, so that when
I totally agree. I totally agree. So you know what I do for a living, and we've talked about like patients before, and you always had such great insight on like people that have hernias or diastasis recti or had surgery before, and kind of understand how to tailor them to their needs with different like abdominal and core kind of instabilities or things that kind of destroy your core, and you understand anatomy really really well, which is why I brought you on today, because I feel that it's great to talk about like mesh and non-mesh and like all these like to surgeons, but sometimes you just need to sit back and be like, okay, let's be very practical
How
here.
do the civilians talk, right?
How do civilians talk?
That's how so I grew up as a dancer, and so whenever I like it, not even so much like dancer non-dancer anymore, but just like mover, like professional mover in some
Yeah.
regard versus non-professional mover, I always refer to them as civilians.
Uh-huh.
So like for whatever it is, like if there's your area of expertise and your area of
Yeah.
of this, and then there's the people that are unrelated, so they're the civilians in my vocab. And I think what is really important is to like you said, it's different for every case because every individual is different. Every individual started somewhere else when they acquired this injury,
Yeah.
and everybody's injury has different levels of severity, so they're going to also come out of the other side.
Yeah.
So it's
So
not just go ahead.
let's get some of that lingo out. We have a lot of questions that have been pre-submitted, so I'm really excited to get those answered, but let's start with some core questions. What is the core, and what do we mean when we talk about core exercises?
So for me, like I have a extensive background in Pilates. And so, core, for those who are familiar with Pilates, is a huge, and see, it's probably the biggest focus in Pilates. And, it's your abdominal muscles, but it also includes your pelvic floor.
Yep.
It includes your, like your back muscles. It's that
Mm-hmm.
whole central area that is holding the center of your body together.
Yeah. Your diaphragm. Yeah.
Your diaphragm, like top, bottom, side to side, front,
Yeah.
back. Yeah.
Yeah. We when we draw the core on our notes, it's like a picture of a hexagon.
Mm-hmm.
So like the two ribs, the
Right.
sides, the pelvic, and
Yeah.
then
But then you got to
everything
turn
inside.
it around because you got to take the 360 angle. You can't just do the
Right.
front on.
And then let's talk about Pilates, because I love Pilates. I don't like yoga. And I feel like when I tried to do yoga that was a bit more higher level than I should have, I got injured. So I don't like yoga, but there are tons of people that like yoga. So what's the difference from a core standpoint for someone who has a hernia or may have a hernia or has had surgery? How should they look at yoga and Pilates differently?
Okay, so I want to disclaimer these next comments with I am completely biased again because I come from a very heavy Pilates background. I practiced yoga for several years. I had several instructors that I loved and that I followed their practice. For me, it is a physical practice, but
Yeah.
for me, I got more out of the mental part of it. And I think that there are definitely benefits to both.
Yeah.
What I noticed when I was practicing yoga is that it was very upper body dominant. And I think that comes from the fact that yoga was originally designed and created for the monks that were men, and men tend to carry their strength in their upper body. Women carry our strength in our lower body.
Okay.
So I think that that's why I was, messing up my shoulders, feeling it in my neck, getting a lot of strain on my wrist.
Yeah.
And I think too, again, in the original creation of yoga, it's a physical practice, but there is a lot of focus on that mental and that mind body connection. So it's not necessarily geared towards getting you to focus on muscle groups, which isn't how I necessarily train either. But I think that a lot of times when people aren't being mindful, they might not protect themselves, or, give that proper relationship or that attention to the parts of their body that needs it. And so then injuries, and this could totally work in the reverse too. It can work if somebody, that is doing a similar thing for Pilates, or, or weightlifting, or running. Like you could it just takes one moment of mindlessness and just injury can happen.
And you're also an expert in GYROTONIC. That's a very specific, trademarked kind of fitness instruction. Can you explain what GYROTONIC is?
So GYROTONIC, that is such a loaded question. I mean, it's like everything else. But so yes, I'm a GYROTONIC pre-trainer. I'm also a gyrokinesis trainer. So if you are familiar with Pilates machines have like the reformers, the Cadillac, all of those. That's sort of like what GYROTONIC would be. It has machine applications, and then gyrokinesis would be like the mat stool version. So you don't necessarily need
like you do at home
the equipment. Yeah. But not to say that you need equipment to do GYROTONIC either. I mean, there are ways to adapt around it, but the equipment is what is giving you that support and that accessibility.
Yeah.
But it is a modality that tries to focus on connecting your skeletal body, your muscular body, and your nervous system all together. So it's for me, in my opinion, it's a very complete system. And it also is completely about movement. It's not about a position. It's not about an engagement of one muscle. It's about the relationships that happen in your body, because, I could lift my arm, but that's not just my hand. That's not just my elbow. And then it's not just the muscles, it's the bones. It's the brain telling my arm to lift it, so it gets very in depth, but also, there's, like everything else, there's a way to break it down, or to translate it for someone else that needs to hear it differently. So
yeah, you've worked with me on the GYROTONIC machine, and I love it. I think it, without stressing you out, it forces you to stretch like your shoulder girdle in a way that I don't think you can really do anywhere else.
So that's
really cool.
my biggest thing with it, is I feel like with my shoulder specifically, it's helped me rediscover the relationship and the functionality of my shoulder girdle, and also just my entire spine.
Yeah.
It creates elongation, and space in the body, where, like a lot of our times our bodies want to be like this because we all live very stressful lives. But it reminds you that you are a living, breathing being. And so your body needs to live and breathe and expand and move.
Yeah, it seems to me that like it's kind of undoing the reverse of everything else we tend to do. We tend to hunch over, we tend to kind of cow forward, and it does elongate and stretch and move your body in ways it's not normal to do during a normal like work day.
Right. So the picture that was always painted for me that I really like with GYROTONIC is Julia Horvath, who's the creator, very much still alive. Very fortunate to still have him here creating and feeding us information as trainers. But he pictures the spine as the support system for your entire body, which it completely is. It's your shock absorber. It's all these things. But when your spine isn't healthy, alignment and functionality, it's moving, then everything else can, like, it's like a coat hanger. All the coats can hang on it, and all the coats can reach off of it. Like
That's
it's like
true.
the base of the tree, it's the trunk, everything can reach out. So
we have tons of live questions, so I'm really excited about it.
Oh, we do?
They are very specific questions, so
Okay.
if you can help expand on it. So the first question is, I had inguinal surgery with mesh 5 months ago and have recently started doing planks for core workouts, but I'm afraid to do crunches or leg lifts. Should I worry about doing any specific core exercises?
So again, in a very general sense, you have to listen to your body. I'm sure there's a generalized time that your PT will give you, like you wait this long to do this, you wait this long to do that. And I don't want to give these
5
specific.
months is fine. Yeah, 5 months after surgery, inguinal surgery.
But if you're at 5 months and you don't feel like you're there yet,
Yeah.
I definitely wouldn't push it. I would err on the side of caution because you had something surgically sewn back together. So you've
Yeah.
got to give, even though that is the typical, like you've got to give your body enough time to do what it needs to do and understand that your body isn't the same as, A, B, or C's body.
Yeah.
But then at the same time, you need to be in enough connection with your body to know that the difference between, that fear and actual like safety, because
Well,
you
let's
don't want to
discuss this.
baby things. You
So
want to
let's talk about
try.
plank. Plank's
Yeah,
a
let's
pretty
talk
good
about
core, right? Is there
planks
any
are
way
my
to
favorite
injure
exercise.
yourself? Planks are great, and there are different ways of doing them. Is there any way to injure someone? Can someone injure themselves doing a plank?
Oh, you can injure yourself doing anything.
Oh my
You
God.
um but yeah, I would definitely, start with modifications.
So like
Start with
elbow.
start with quadruped. Start with quadruped.
Oh,
You're on hands and knees and you just engage
elbows
your
and knees.
transverse. No, 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 not even on your elbows yet. Like find the
Oh,
stability in your back to wrap around and support your rib cage, and then use that support to engage your core. Keep your back nice and long. Keep your
mm-hmm.
head in line with your spine. The second
Yes.
your head drops down, everything's curving over. You've already put yourself into a state of flexion, even if it's minuscule. Like you want to get all of that out.
So head needs
Yeah,
to be in
super
line with the spine.
head in line with the spine. Yeah, that is the most common correction that I give, and I teach planks every day to almost every client and in every class because it is my favorite exercise.
And the
Some version
shoulders
of
need
it.
to be relaxed. People do a
Uh,
lot of this.
I wouldn't say relax because you want your shoulders to engage down. You want your scapulas to draw down. Basically, plank is a full body exercise. Your entire body should be engaged. Your
Okay.
back should be working. Your neck should be long. Your neck can be relaxed, but there's still the back of your neck has those extensor muscles that need to be engaged to keep your head in line.
Mm-hmm.
So, and if it's too much having gravity with you on the floor in quadruped, then you start with wall sits and you just pull into the wall.
Oh, okay.
So
And then staying on the plank, someone else wrote that I was planking for physical therapy when I felt the worst hernia pain, and then I had bilateral inguinal hernia mesh. I'm so nervous to do any core following mesh and mesh removal now, even though I'm a mover. How do I start back? So I think planks. So are planks good if you have a diastasis? Does that involve the transversus abdominis
yes, I mean
much?
everything has to involve your transverse, because your
Yeah.
transverse is, for a lack of a better description, your corset or your girdle, and it's going to hold everything together.
Yeah.
So when you have the diastasis, if these are your two sides of your abdominal wall, and it's splitting like this, if your transverse is engaged, it's going to pull it back together.
Yes.
And then let's see, I have a pen here. So if you have like a hernia and it's pushing through somewhere, if your transverse is connecting together, it's going to pull it back and try to
Yes.
hold it in place.
Yeah,
So
we're going to talk about the transverses a lot today because that's the key to safety for all hernia anything. What about crunches and leg lifts? Tell me about like sit-ups. There's like 5 million different ways of doing sit-ups. We
so
don't
I
like.
mean, well, there's like one true way to do a real
Okay,
sit
I
up.
need to hear this.
There's a lot of creative variations that people will come up with to
Yeah.
cheat around actually activating their abdominals.
Ah,
I think if you're dealing with an abdominal injury, I would X the crunching, because again, that forward flexion is going to put that pressure down. And when you put, I wish I had better props for this. Like, we'll use this little cord. So like if you put that pressure down this way, this is going to want to pop up. So if this is your head and it's
yeah.
coming forward, this is going to want to pop up, and we want to keep this really flat, which is the goal. It would be that you keep this flat as your head abs
Yes.
come up and around. But again, until you can get that connection with your transverse and that feeling of holding in, it'll be really challenging. So I would do diaphragmatic breathing, where you're laying on the floor and you're just letting your rib cage expand and then engaging it back together. I would do, like I said, just quadruped, and then because once you have it on the floor and gravity's helping push it down for you, then you work against gravity, and you flip yourself onto all fours, and you keep your ribs and your abs pulled up. And then again, I'm just a really big, like, let's play with the effect of gravity, because we're not always in one position.
Less injury.
Yeah. So if you want to sit on a ball against a wall, like let everything relax, and then pull it all up and together and try to engage.
Okay, can you talk about this transversus abdominis? Because even for sit-ups, some people think it's all about the rectus, and also, you know, the guys love having that six-pack, but really
all that the sit-ups are going to do is give you a six-pack. But have you ever seen those people walking down the beach and they've got like the six-pack, but it's like hanging out, like it's not, it's, you know, like they don't have that nice flat.
Yeah, it's not a flat abdomen.
Right. And I'm not one for like doing things to make you look a certain way. Like, I understand people have their own reasons for why they want to work out. But I'm all about functional, healthy movement in bodies.
Yes.
So when I see that, I just see, like, you know, I see zero engagement in their core. All they do is sit-ups and reverse crunches, like those Roman chair lifts. And so they've worked their rectus, which your rectus, do you have a picture of the rectus, Shirin? We should have talked about pictures.
I'll bring a picture while you do that. Sure.
Yeah. So basically your transverse is the girdle, and then your rectus sits like right in front of here, and that's where your six-pack is. So all you're doing is like crunching your rectus, but your transverse is just pushing out, pushing out, pushing out. So from the side, you're just getting more and more lax. So until you can keep this engagement, this isn't all your rectus does is pull your body forward. It doesn't provide support. It doesn't, you know,
we gotta let go of the
lift yourself up. It's not that it's not important. It's just that I would say that it is minusculely important in comparison to how important your transverse is. Aha.
The rectus is what's in red right here. It's your six-pack, and people love it. There are actually surgeons that carve out a rectus with liposuction.
Oh my gosh.
It looks like you have a six-pack or whatever. It's pretty cool, actually. I've seen it done.
Get a spray tan then. Don't be carving out.
But if you look deeper, there are other muscles, and deep to the rectus muscle is this muscle that you were talking about. We call it the inner girdle. It's the only muscle that wraps around 100% all the way around, whereas the rectus
spine around the front.
Yes. So when you tighten that, that's what flattens out your belly. Correct?
Right. And yes, and more importantly, yes, it'll give you that flatter stomach, but more importantly, it will hold everything in. You will be supported. You will have, if your transverse is strong and connected, you will have less back pain. You will have less, you know, probably less lower leg tightness, because you have, you know, less tightness in your lower back, and you have that abdominal strength. Your legs can move freer underneath you. Your shoulders can connect down better because they're not lifting everything up. You know, it's the center of your body, literally.
Yeah, this is like an ugly picture, but no one loves to have a beautiful transversus because it doesn't look good. It's just like a round muscle. But once you tighten that, it sucks everything in and gives you this flatter abdomen on the inside. So on that note, like, I have no idea how to do a transversus abdominis engagement, but to do a correct planks or leg lifts or correct crunches, if you focus not so much on the rectus but on the transversus abdominis, then you shouldn't have any pain. In fact, I'll tell you this. So I've quoted this study before. Medical students were studied as normal patients to see if they do certain exercises, how will that affect abdominal pressure, assuming that increases in abdominal pressure are bad for hernias. And crunches were considered totally fine. And everyone's like, how is that possible? Crunch, you know, my belly pooches out. Like, well, you're doing it incorrectly. When you do a crunch, your belly should be engaged and go inward, because that's the transversus pulling in.
Yes, 100%.
Do you have any tricks on how to engage your transversus abdominis?
Let me see. Give me 1 second. I'm gonna scoot back and try to grab an actual prop.
Because I've learned that it's very difficult, and most people don't really think that much about it, and so they work on their six-pack instead.
Okay.
Okay.
So I have a TheraBand here, If you don't have a TheraBand, you can use a scarf, you can use a towel, you can use a yoga strap, you can use a tie. You just need something long, because we're not going to, push hard here. But you wrap it around your rib cage, and then you would just breathe in, and you want to kind of push out to the sides. And then as you exhale, pull your abs in and let this gently squeeze. So you should be able to tighten on the TheraBand.
Are you on your ribs or you're below your ribs?
You start on your ribs, and then you would work your way down, depending on how wide you can get it. But what you don't want to do, if I angle this down a little bit, what you don't want to do is you don't want to like just squeeze the band, because that's not going to do anything. You want to kind of just keep the band engaged and then pull away from it.
Pull your belly towards your back.
Right. Pull your belly towards your back. Even think about pulling your back towards your belly. So you're literally engaging on all sides, the sides all pulling in. So if like your ribs are kind of like a bird cage, you're pulling the contents of the bird cage away from the actual steel frame.
Yeah. Which would
metal
make
frame.
you able to tighten that scarf or TheraBand.
Right. Like, yeah. And so you should be able to tighten it, but you don't want to just squeeze it.
Yeah.
Because again, it's not an external effort, it's an internal effort.
Okay.
So it's about pulling away from the band.
Have you heard of the Toppler technique? Did we talk about this?
No. It
Toppler?
sounds familiar, but
Julie Toppler. I didn't talk to you about Julie Toppler.
No.
So I believe she's a nurse. So her career is purely based on diastasis recti reversal, prevention, and treatment in women. She has a whole Toppler technique, which she's trademarked, and she has books and videos.
Oh, I've heard of this. I'm not super familiar with it, but I've absolutely heard of this. Yes.
So a lot of what she does is transversus abdominis engagement, as well as binding and taping. So the goal is to reverse diastasis recti. I believe she recently has presented her data that it actually works, because there's very little that truly works to reverse diastasis without like a tummy tuck or surgery.
Right, to like physically sew it back together. Correct.
Bring the rectus muscles back together again. But I do believe, I think if you initiate early, like after like a pregnancy, it's a better option. Let me ask you another question, also live. What are some specific exercises that are beneficial for lower back pain and tightness? Like, I think Pilates is great, honestly, because it strengthens the core, and that tends to reduce
right. So
all tension.
Yeah.
Plus
it's such a loaded question, because there are so many things that could make your lower back feel better.
Yes.
And I think the biggest thing, first of all, is you have to find a modality that you resonate with. So like, for me, it's Pilates and gyrotonic and functional movement training. And, but for a lot of people, I've had people try Pilates and they hate it. And I've had people try gyrotonic and they hate it. And it's not my job to make you love a modality. It's my job to give you as much information as I can. But if you don't like what you're doing, first of all, you're not going to stick with it long enough to see a result from it.
Yeah.
You're just not. And second of all, like you're not going to, even if you did like force yourself to stick to it, you probably won't connect with the work. Like you won't, if you're not connecting with it, you're not going to receive the information that the work is trying to give to you. So
what do you think of these belts? Like when you go to Home Depot, people are wearing belts. Does that work?
Oh, like the back support brace?
Yeah.
So I have first of all, again, I think this is not like a one size fits all question. I think that they are great for adding support. They do not do the job for you. Okay. So, those workers at Home Depot or on a construction site or around your house, if you're wearing it, wearing this back brace or this lumbar support, it's great. And it's wonderful. It's going to give you that extra reminder
Yeah, it's
and,
more of a
you know,
reminder.
feedback, but it's not going to do the job for you. You still need to engage in your core muscles. You still need to make sure you're lifting with your legs. You still, you know, you need to do all the work still. It's not there is no quick fix for these
Yeah.
things.
Yeah. And then can we discuss weightlifting also? Like, is weightlifting considered core workout?
I mean, yeah, you can absolutely do core workouts with weights. Again, like I said, if weightlifting is something that resonates with you, I think it's all about finding functional movement patterns and you know, like building up strength in complementary and oppositional form. So you're not like, you wouldn't just do bicep curls and never do tricep curls. That's like the most basic way I can explain it. Don't just do leg presses and never do hamstring curls. Like, you know, so for your core, like, don't just do crunches and never do planks. Don't just, you know, like, don't just do the reverse lift, but never do anything for your obliques or your, you know, the rotation. Like, you have to do all the things. You don't want to be the guy at the gym that has like the giant upper body and like the skinny legs. And like, first of all, like, that doesn't look that
so for a while,
but functionally, like, that man could fall over, and he's building. And also, when you build those kinds of imbalance, this is going on a kind of another topic, but when you build those kinds of imbalances in your body, like, your fascia gets all messed up, and like, you could actually create bigger problems for yourself.
I see tears. Yeah,
exactly.
I recently
and pulmonary stuff can build up. Like, it just, be balanced, guys. Whatever it is you're doing, do things that are balanced.
I had a patient, there's like this new fad now where you wear these like wetsuit type outfits that have these electrodes and you crank it up.
Oh yes, I've seen these.
What's that called? I don't even know.
I don't know. But I've seen it on like Instagram and stuff. You know, because
it contracts your muscles like, I don't know, 1,000
for
times
you.
a minute. Yeah, for you.
Right. But again, I have a great example for this. So I have a client, like, kind of on this. I've never used these electrode things because I'm always trying to get my clients to self-engage. I don't want, you know, I don't want to give them a shortcut. But I am a big fan of the vibration plates.
Okay.
And I have clients that have them. And I have one client that loves it so much, and they always want to use it. And I tell them, you cannot use this every time, because you need to be able to find these connections and these workings in your body without it.
Yeah.
So it's like, you know, you don't just do the same thing every day. You know, you can't live on, I mean, I'm half Mexican. I wish I could live on rice and beans and that's it. But like, I have to eat some vegetables. I have to eat some chicken or like some protein, whatever it is for, you know, like, variety is the spice of life. And it's also like what keeps, like, diversity keeps everything running. Right. And that works in your body too. You don't ever want your muscles to get to the point where they're just habitually working, because they'll stop engaging. They can, you know, like, I can do this with my arm and I'm not doing anything to my bicep, even though technically my bicep is working to bend my elbow.
Yeah.
You know, but if I like squeeze my bicep, that's a different thing. So I can't just do my bicep this way. I have to sometimes do push-ups. I have to sometimes, you know, find other ways to engage it. So
yeah, so he was doing this, and then he got sharp pain, a hernia, whatever. So he had a hernia. This is the thing. He had a hernia. It had nothing to do with it.
Okay, that's
he didn't know that he had a hernia. And then,
okay.
But I think all that contraction, like in the belly area, really pinched the hernia more, like made it more inflamed. So, but when I operated on him, he had all these little micro tears in the fascia. And sometimes I wonder if contracting your muscle 1,000 times a minute is not good, because you can get little micro injuries.
I think if you were to do it occasionally, you know, like, because that's essentially what lifting and all of these strength training type things do. You're making little tears so your muscle can rebuild. But when you're doing that, again, if that's your habitual state, is to break down. This is why recovery days are so important for people that strength train. You have to give your body that time to recover.
Okay.
Otherwise, you're just always breaking down.
Yeah. Yeah. There was a moment, as you know, that I was a member of Gold's Gym. For those of you who may not know,
The Mecca.
it's the Mecca. It's where it's owned by Arnold Schwarzenegger.
Muscle
And
Beach.
you got Venice Beach in California that has Muscle Beach, which is affiliated with, it's like the beach version of Gold's Gym. And I'm like the only normal person there. Everyone else is like super buff and hyper muscled out. But my trainer is like one of those guys. He's like a very well known in the field, and he like shows me, and he's like, see what these guys are doing. These men, they love like their big chests, so they do all this chest workout, and then they like end up being like this hunched over look.
Yeah, they physically, they don't have the accessibility in their back to
Yes,
pull their shoulders. It's
exactly.
frightening,
Yes,
because then you are also pushing your spine forward. And
yes,
if my spine is here, if my head weighs 8 to 12 pounds, think
yes,
about how much pressure I'm putting in front of like my spinal cord. Like I'm just,
yes, yeah,
you
yeah,
need a disc all over your neck, man.
yeah, absolutely, absolutely. Okay, let's do some more questions. Actually, one person's asking you, do you Zoom with patients?
I
Can
do.
you
I
Zoom
have some well, patients there. I'm not a doctor. I have clients.
with your
All my
clients?
doctor
Can you
clients and
Zoom?
surgeon clients, they all ask me about my patients. I'm like, I don't have patients. Yes, I do have clients that I do Zoom sessions. I do in-person sessions, it's with, with proper COVID compliant
Yes, for
safety,
sure. I
obviously.
would
But yeah,
highly
I
recommend
do Zoom.
at Move with MJ. It's the best. During COVID, I was on your website because you had um, a great website for all these different things you can do at home. Like you can do Pilates at home. I didn't know you can do that. And
Yeah, you don't need equipment. I have gyrokinesis classes on there. And granted, like all of my current on-demand stuff is for like generalized population, but if that's something people are interested in, I could make on-demand things for specific case for scenarios.
maybe we should do a hernia one together.
I could do a hernia one.
Yeah, and a diastasis one separate.
I could. Yeah, we could definitely do. I mean,
I would love that.
they'd be very similar. I feel like we could just make it kind of like we could probably do like 3 and it's just like a little series for
Right.
people. Yeah.
Yeah, so at Move with MJ
Yes.
or movewithmj.com.
It's all on there.
Yes.
Just go there.
Okay, question. My core got weak from surgery and I have constant lower back pain, which is in conjunction with the abdominal wall pressure. What is the treatment for pain that comes from the core back pain and abdominal wall tension? It hurts with application of pressure and laying down hurts. Okay, so let's say you have someone who's ill or has a lot of like a big hernia or like a core problem. Obviously, they're not going to be doing any extreme exercises, but is like stretch.
Functional movement comes in all forms. There,
Yeah.
like it seems so uh what's the word? Minuscule and, you know, uh irrelevant, but the tiniest little movements can make such a huge difference if you're versus doing nothing.
Yeah,
And
let's not do nothing.
I'm a big believer in stagnation is death. Like I think that once you stop moving, like you're slowly dying. Like that's like so like whether it be like your muscle die, because if you don't use it, you lose it. Like that's a real thing.
Yeah.
So look at all professional athletes. If they don't continue to train, they're not going to stay at their competitive levels.
Yeah.
And that goes for everything.
Yeah.
That goes for your brain. That goes for
Okay, well, that's a really good transition to this other question which I had, which I hope that you can help answer, which is how do you find like the right instructor? You don't want some guy straight out of high school that calls himself a trainer, right? Like, how do you
right.
find the right fitness instructor? Are there certain things they should be doing or certain
Well,
like training or years or affiliations? Is there a society?
so again, this is not like there is no universal answer to this because we were all first day trainers at some point. I think again, you need to find someone that you are resonating with, like whether it be their style, whether it be the way that they communicate their information. Because if you don't like your trainer, you're not going
Oh
to
yeah.
go back.
Yeah.
I mean, unless you're just a total masochist, and
No,
I don't know.
my first trainer I got straight out of like, a gym. I think it was 24-hour fitness. And
And
I was
yeah,
like,
and
why am
then
I
with
listening to this guy? I feel like I'm listening to someone that has no clue what he's talking about. Why am I listening to him?
yeah,
Yeah.
and and then I'll come back to that. But like the other blanket statement I want to make is, if you are coming at this from a post-op situation,
Yeah.
you don't want that first day person.
Yes, correct.
You want someone with experience and knowledge, or at least a very, very, not at least, but at minimum, a very, very credited certification behind them.
Yeah.
So, because I don't want to say, because it's not that you need to be the longest standing trainer to be a good trainer. I've watched people be excellent trainers like right off the bat, because everybody comes from a different background. Like I said, like I was a dancer. I have friends that were triathletes. I have, I have colleagues that were professional college players, or, you know, or doctors or lawyers, and everybody has something to bring.
Yeah.
But if you're looking just, so first of all, if you're coming from a post-op, try to get somebody that has experience with what you're working with, because that will make you comfortable. That will, and not to say if they don't have experience that you can't work with them, because again, everybody's got to start somewhere.
But
Like there was
maybe that's why so many get physical therapy sessions, because there is some kind of formalized standard that physical
right.
therapists follow. But like I get, I had to go to physical therapy, and I thought my physical therapist was great, but I got much more out of you. But I'm lucky I have someone like you available to do that. And I think there are people out there that can replace a physical therapist that'll kind of integrate
Well, a good
more.
trainer will take what you, so if you're going to physical therapy,
Yeah,
because you should go to physical therapy, you
yeah,
should do the exercises that are given to you post-op and all those things. But you should also, either with the physical therapy or after the physical therapy, you should continue your investment in your health and your movement,
yeah,
because your body is the only one you have. But you should take that information to your trainer, and a good trainer will take the information that you're giving them, and they will incorporate it and they will integrate it into what they're giving you back.
yeah, I totally agree. So for this
So,
patient, I would say number one, be active. And number two, find someone that can help you, show you how you can be active safely. Because when you're in pain, you really need someone that understands what is inappropriate pain, and then go very slowly. Like,
right.
uh,
And communicate with that person as much as you are comfortable with. Like obviously, you don't have to overshare things that you don't feel are appropriate. And and some trainers don't want to know too much information, but as far as your physical state, you need to give them as much as you can so that they can come back to you with
yeah,
that information, giving you appropriate choices for your workout
yeah.
and your sessions.
Next question is a little bit surgical, but you may be able to help too. I'll answer part of it. After mesh implant and removal, I got this painful depression, kind of scooped out area on my rectus abdominis area, and it's sensitive and always hurts. Is this fibrosis? What is a likely cause of this? It's a nagging ache, and it did not improve with mesh removal. How can I treat this, and who do I see for this? So mesh removal of the abdominal wall usually is not cause like nerve pain, so I can't say it's nerve related, but it does take away a little bit of tissue. You may have a repair that involves the fascia may be tearing. Depending on how sutures are placed, that can be tearing through the areas. um, but a lot of these questions, like this one and the one before, if you lose weight, you take much more tension off the abdominal wall, if you learn how to engage your core, like Marcy was explaining, that also takes tension off your hernia repair and the abdominal core. And so those are all two things you can work on to help reduce that. And then maybe we can talk about scars as well. What do you think, Marcy?
I mean, that sounds very surgical. I don't like to pretend to know things that I don't know.
Yeah.
It's like
What do you do for scars? Do you have people that have painful scars that like you roll it out or something? Like you roll out fat?
Yeah, well, because again, this is kind of like a surgical thing, but in my experience, my personal experience with scars and my experience with my clients with scars, the scarring and the scar tissue under it, if you can break up that that fascial like hardness, it tends to relieve some of the pain. But again, I don't want to say like as a generalized thing that that's okay to do, because like you're saying, like what if there's a nerve thing? What if there's like a suture that's still in there? Like I don't want to make generalizations. But yeah, but I mean, I think that it's important to break up like the lactic acid that builds up in your body.
And massaging out scars has been shown to make you, it takes some of the inflammation away and also encourages more remodeling of the scar and increases blood flow to the area to help remodel the scar.
Right. Well, because blood flow to the area generally in terms of rejuvenation is ideal, right? Like, because your blood flow is what provides the body with the things it needs to rebuild. So
yes, yeah, exactly. Let's talk about gluteal bridges or a pelvic bridge. Sure. I believe I tore my hernia repair doing a gluteal bridge. What muscles are being loaded and how can I injure myself with the bridge? What is a gluteal bridge? It's become a very fad thing lately, I feel.
Okay, so bridging is a hip hinge. And I mean,
it's a what?
From hip hinge, like when you engage your glutes and you hinge up from your hips, you extend at your hip. Okay. You do these. Like you do these.
I like it.
Yeah, no, I mean, they're super important because glutes, you do them. Glute strength is really important because a lot of times when you don't engage your glutes and you're just thrusting your bones up, your two ASIS up to the ceiling, you're going to extend through your abdominal. You're going to not engage through your transverse. Everything's going to spill out through the top. Your ribs are going to splay open. And you're going to cause pressure and you're going to cause, so I feel like, I mean, that's my best guess as to maybe how they tore their hernia repair.
I think so. I have a patient
without having seen them do the exercise and knowing, where their injury was and things like that. I can't say for sure.
The gluteal bridge is, as a term mentioned, it's a gluteal contraction.
Yeah. So you would engage your glutes, your knee, min, max, to lift up your hips. So your glutes would squeeze, your butt would lift, your hips would go up. So you would extend through the front of your hips. And ideally, you would keep your transverse and your abdominals engaged so that you would be, for me, I like to do my bridging straight line, knee through the hip to the shoulder, because then I know that everything is extending, elongating, engaging. There's room for everything. I know that in a lot of yoga practice, they like to arch their back. Yeah. Which is not, that's something else, but especially from a post-op, like kind of like rehabilitative standpoint, I would really keep that, nice and level. Yeah.
And some people put a weight over their kind of
on their hip. So you would, I mean, again, if you're coming right out of op, I wouldn't do that. As your glutes get stronger, you can put a weight on the front of your hips to lift, to increase the load for your glutes. Yeah. But a lot of times people do that before they've even learned how to engage their glutes. Yeah. So until you're really feeling it and firing in your glutes and also in your hamstrings and the backside of your thighs, like all of your entire posterior chain needs to engage before you can add any kind of load to the front.
So I had a young female who did that. She's like very like fit, almost like a bodybuilder type, but not like the slim bodybuilder. She's like, you know, thick.
Like an Olympic bodybuilder.
Yes. And then but she's short. So then she was putting heavy weights over her hip. And I think a lot of people, they do these like pelvic bridges with lifts with the weights. It's not they don't do the gluteal activation. It's all like at the
They're just throwing their back out is
waist.
what they're
Yeah,
doing.
they're
It's
throwing their
very
backs
scary.
out.
I generally can't watch most people just at the gym, you know, not necessarily working with any, but just these people on there. I try to have tunnel vision if I'm going into the gym, because I can't fix everybody. And like, also like, you know,
Yeah, they let their back arch down and they pull the weight up. And then, so she actually she had a sports injury. She had a sports hernia. So it's because you try and overcorrect.
yeah, and then
You're
push
tearing your
right up.
radius or your adductors off of the bone, and doing so because you're overcorrecting instead of remaining in line with your spine. You're kind of like doing beyond. So yeah, there's a term called gluteal amnesia. I don't know if you've heard of that. I may have talked to you about it.
Gluteal amnesia.
Like,
This sounds familiar.
yeah, it's pretty interesting. It's like an old idea, but people forget that they have a butt. And so they end up like, for example, they'll go hiking or up a hill and they're using
Oh,
their knees.
yes. And then their knees. Yeah,
Yeah,
100%. You
they're
have to,
supposed
when you're hiking uphill, you have got to squeeze your butt and push from the back of your leg. When
yes,
you are riding a bike, you have got to pull up from the back of your leg. Like
yes.
you cannot just push down, down, down. You
So
will
that's
wear
the
out all of
gluteal
your joints. You'll
amnesia.
wear out your knee, your ankle, and you'll mess up your hip.
So everyone
Stop
out
doing
there,
that.
I'm going to give you this task. When you're going, you're at your house or wherever you're, when you're going up the stairs, don't use your knees to go up the stairs. Use your buttock muscle to engage, to pull you up the stairs. It's a huge difference.
Yeah.
Yeah. Okay. I just want to bring that up because I love that word, gluteal amnesia.
Yeah,
So
that's
good.
fun.
Yeah. Okay, next question. Okay, well, I guess it's kind of at the core of what we're discussing, which is, do core fitness exercises decrease hernia formation? That's why we're here, right?
I mean, so the stronger your core, the more that it can do its job, like, you know, the actual core, your transverse, the more it can do its job, the less things will want to push out in places they don't belong. So, I mean, in my opinion, yes, like it's not going to necessarily fix your hernia. It's not going to pull it back completely. But if everything is engaging on top, it will keep it in line more.
Yeah.
It won't keep it from pushing back out if you get lazy and you start throwing your hips up and not engaging your glutes and not, you know.
Right. So there's a study, it's an older study. I think it's a Danish study. It's a population study, looked at women actually. It's one of very few studies that looks at women. And they followed them over years and found that women that exercise are less likely to have hernias than women that don't exercise, which to me says exercise is protective of hernias, even though hernias are very much a genetic predisposition. But just because you're predisposed to getting a hernia genetically doesn't mean you will get one. And if you maintain core strength, either you won't get a hernia that's relevant, or if you do, it's very well controlled. It's not going to be painful. It's not going to be big. And I see many patients who get hernias. They go to their doctor. Oh, you have a hernia. Don't lift anything. Stop your exercises. And they gain weight and their hernia gets bigger and it becomes more painful. Then they send them to me. Here, go fix this hernia. And I have a discussion with the patient. And I learned this story that where they used to be fit and now they're not, and they've gained the weight and they have a larger and worse pain with their hernia. And I say, hey, why do you need surgery? Go back, work on your fitness, reduce the weight, focus on your core. If you can get all the surrounding muscles to support this hole, it won't cure your hernia. But if we've done the job to make it so that you don't have pain and your hernia is no longer visible, why fix it?
Yeah.
And many patients can work it backwards or pay it forward by maintaining core strength from the get-go.
Definitely. I think that kind of goes along with like my topic of like, there is no shortcut. You can't just like buy the next level thing. You know, like you have to go back and you have to put in the work. Like if you're an active person and you get this hernia, it's not about not doing anything active anymore. It's about retraining how to do it smarter, how to do it better. You know, it's about evolving with where your body is now.
Okay, here's my favorite question. What do you think of CrossFit?
Oh, CrossFit. Okay, CrossFit. Listen, I have several friends that love CrossFit, that like swear by it up and down. It is everything. It is their end all be all. And yeah, great. I'm so glad you found something that you love, that makes you happy, that gives you X, Y, and Z in a positive nature. Please do something to cross train and keep your body healthy.
Yeah.
Because the actual motions of CrossFit, CrossFit is not functional movement. CrossFit is a sport. CrossFit is not,
good point.
You know, you are doing it to get to a next level. You are not doing it to create a healthier body.
What
Like,
about,
sure, could you lose weight from it? Absolutely. Could you get stronger muscles from it? Absolutely. Are you going to do all that in a balanced nature? 0% chance.
wow. What about P90X and those other kind of branded exercises?
So truth be told, I've
seen-
never done P90X. I've like kind of watched some of the promos for it because I know
Yes.
everybody's like super crazy, like Insanity and all those.
Yeah, Insanity workout. Yeah.
And I think that the reason that they get so much hype is you market to people that go from doing absolutely nothing to throwing themselves into high intensity intervals.
It's
And of
high
course, you're
intensity,
going to see like crazy results because they were doing nothing.
yeah.
But then, like, you know, and again, if it's bringing you joy and happiness and things you want to see happen in your body, that's great.
Yeah.
But then make sure that, you know, if you start feeling pain, if you start feeling achy, that you start doing things as you get more connected to your body, as you get more into an active lifestyle, that you start to make choices that are going to give you longevity with it too, not just for today, but for tomorrow. Because like you can look like a supermodel, but if you can't get out of bed, like what does it matter?
Oh my God.
Like if you literally like if you put your knees over the bed and you can't stand up, like it doesn't matter. You can't, nobody gets to see you if you can't walk out the door.
I have had a couple of patients that came to me, had serious injuries after a P90X and Insanity workout, like sports hernias. Yeah. It's not fun.
And I mean, and that's with anything, you know, and again, it can be done in any modality. You know, I don't want to name names, but there are certain quote unquote Pilates type places that have sent me several clients post injury destruction because they're just doing it to feel the burn or whatever. I don't know.
Yeah, I know. It's, you know, it's more like to motivate, I think, but I get motivated just seeing you, honestly. I love my sessions with you. You know, I've been through a lot and you've taken me through so much of it in a positive way. So I do appreciate it. Can we end on diastasis recti? It's a question.
Yeah.
So what is it? We know it's very genetic. Not everyone gets it. What exercises should they definitely not do? Because I'm told, for example, don't get out of bed moving forward, like in a forward way.
Yeah, turn to your side.
And so on. But like crunches also. Tell me a little bit more about, or planks considered not safe. What do you think about diastasis recti and some of those exercises?
So, you know, if you're in like the beginning of it and it's extremely painful and you can't control it, and you know, then it's sort of all the things like as if you were just to have had a hernia repair. Like you would want to just work on that transverse. You want to keep everything in a long supported state. You don't want to do the flexion. You don't want to do the extension because for diastasis, popping either way is gonna cause the issues. It's because, you know, it's like you're going to break. You don't want it to split open that way, and you don't want it to push back the other way.
Yes.
So think about, you know, those old fashioned coin, I'm going to date myself right now. Those old fashioned coin purses that had the slit in the middle.
Yeah.
And you laid it flat and it was closed. So
For
if you pop it
sure.
up, it's going to split open this way. If you push it down, it's going to split open that way. You got to keep it flat.
So
Nobody knows what I'm talking about, but
okay, so when someone comes to you and maybe early postpartum, or like, are there certain ways that you change your training with them? This will be my last question because I don't want to take up too much more of your time.
I mean, yeah, you know, everybody that comes to me does something different because I don't have two bodies that are the same. I don't have the same body in more than one person. But you know, when you're postpartum, like I have had, you know, clients that have had diastasis recti splits, and with their diastasis, you know, it's all about like how do I move with keeping this controlled? Like, how do I move my arms without flaring out my ribs? How do I move my legs without arching my back? Like, how do you keep the center controlled but still have your range of motion around?
Correct.
So once you can get that, then, you know, and eventually, you know, just because you have it, if you get really strong in that transverse, it's not saying you can never do a crunch again. It's not saying you can never do a plank again. You can do all these things when you're ready and when you get to those points. There is no, you know, but there's no like set time on when that is. There's no, you know, there's no end all be all thing.
Yeah, the takeaway from today is if you have a hernia or plan to have a hernia surgery or you're post-op from hernia surgery, number one, the transversus abdominis is the most important muscle in your body. Learn how to engage it.
That's not just if you have, that's for a lot of people.
That's true for everyone, true. And number two, absolutely do exercises. Do not
do nothing.
Do not do nothing.
Stagnation is death.
Stagnation is death. I should make a t-shirt.
Yeah, I would happily put a bumper sticker on my truck.
Stagnation is death. All right. Well, that's it. We're done. This is the most amazing hour we had. So many questions. Thanks to everyone who participated. That's the end of Hernia Talk today. We're going to have another session again next week on Tuesday with another amazing guest. I think you'll really enjoy it. But I love Marcy. I think she's the best fitness instructor. She's a specialist in movement and knows the ins and outs about your abdominal wall, especially your core, GYROTONIC, Pilates, so much. You can, I already posted up her website. It's movewithmj.com. She'll do private sessions with you. There are tons of courses on her website to work on different parts of your body that are safe. I promise you we will work on something that's hernia related so that maybe we can kind of focus on that because she knows so much. And I hope you watch this again and share it with your friends. I'll post it on YouTube, and thanks for everyone for following me on Twitter and Instagram at HerniaDoc, and on Facebook Live for all of you that joined and asked those lovely questions at Dr. Towfigh. And again, thanks for your time, Marcy.
Yeah, thanks for having me.
See you Friday.
Bye.
Okay, bye. Thank you so much. Bye.